I'm one of the instructors here at UMA, and in this video, we're going to be kicking off the lectures for HT1000, Introduction to U.S. Healthcare Delivery. In the first week, we're going to be covering the following topics. We'll be discussing the evolution of U.S. healthcare. We're going to summarize the U.S. legal system, 3 different sources of law and classifications of laws. We're going to explain the current laws, accreditation, licensure, and certification standards related to health information initiatives from the national, state, local, and organizational levels. In addition to that, or along with that, we're going to actually just look more into certification and licensing and the difference between the two. Okay. So let's start with considering the first one. In this video, we're going to talk about this first one, the evolution of healthcare. So what exactly is evolution is the first thing we should ask, and that's basically how something changes over time. So healthcare has, throughout the history of the United States, has faced constant changes. It's constantly evolving. And some of the things that have changed over time are seen here. First one, treatment methods. Well, if you think about what was done just over a few hundred years ago, 150 years or so, I mean, some of those things might be considered barbaric or outright hazardous today. For example, when X-rays were first implemented, they gave off dangerously high amounts of radiation, and little no effort was taken to minimize any exposure. I mean, thankfully, today we have measures in place to mitigate these hazards, which is why, if we stay with the radiation example, they today when you go to the dentist, they lay that big heavy blanket on your chest, and the lead-lined blanket, and before they take the X-ray, that's to protect you, or at least most of you. Obviously, your face is going to be exposed, but to protect you from the radiation. And also, like say in a hospital, if you go in to have your arm, if you have a broken arm or any broken bone really, or just have a chest X-ray, or even a CAT scan, if you notice the X-ray technician will actually go into a different room and stand behind a protective shield before they actually initiate the X-rays, and that's because the X-rays are additive over time, and it's to protect them from the X-rays. I mean, to us, since we're not going to be getting X-rays hopefully more than once or twice a year, this individual will be, you know, the X-ray tech would be exposed to them all day long. So it's to protect them. And examples like this, of course, can be found in any field of medicine. Okay. The next area that has seen changes is the applications of technology. And this includes both clinical and non-clinical. For clinical treatment, methods that have changed, I mean, the biggest one I can think of is the development of modern anesthesia. I mean, back in the day, they used to just make you, the saying, bite the bullet. You know, you bite on something and someone holds you down and they do the surgery while you're awake. Thankfully, we don't have to do that anymore. We can have anesthesiologists who help us, you know, knock us out, and we don't suffer quite as much. For the non-clinical information handling, that could be, for example, records handling would be one. Some clinics today, I mean, even my own personal doctor's office, they still use paper filing, and there's, I mean, I go in there and at the desk, and there's thousands and thousands of folders of all their patients just on a shelf lining the whole wall. And while that works and has its own advantages, a lot of different facilities, they're tending to shift over to the electronic health records, the EHRs, which provide other advantages. I mean, such as having a database that is accessible from different facilities. You can email things. You're not relying on older, more limited technology like fax machines and those sorts of things. So let's see. Payment mechanisms. Okay, this one has changed dramatically. Okay, over the time. I mean, if you think about originally way back when, folks would pay the doctor directly for their services, and they didn't always use cash. I mean, there was farmers back in the 1800s, and they would pay with chickens or farm produce or whatever they had. And but then after about World War II, mid 1940s, we started to have the insurance as we think of it today. And now today it's changed to the point where there's employer-based private healthcare options, government-sponsored options like Medicare and Medicaid, and several other programs which handle payment. If you think about it, this is actually a really important factor, because by easing the expense of healthcare, making it more accessible to folks, those same individuals actually chose to go to the doctor more often instead of holding off. And as a population, by reducing by reducing costs and making it more efficient or easily accessible, as a population, we've become healthier as a whole. Okay. The next one is healthcare structure. And let's take a look at that one, or the next two, healthcare structure and delivery mode. Let's look at those on their own separate slides. Okay. So the structure. Due to all the constant changes in healthcare, and diversification, there's always been a desire to cut costs. I mean, while healthcare is considered, these folks generally go into it to help people, and that's a mindset. It's a facility, and that facility has to make money to exist. So they're always trying to cut costs and make a profit. I mean, healthcare is a business, and so with this desire to cut costs, it led to it can lead to certain structural changes over time. And two of these are vertical integration, horizontal integration. Vertical integration is the combining of several different services into the same company. So what that is basically, you say you have one facility or one company, like if a certain company owns, they might decide that they want to deal with pharmaceuticals. So, start out owning only a hospital and say, okay, we want to actually control the local pharmacies, or we want to have a rehab unit too, or do behavioral health and purchase a behavioral health unit, and they kind of combine, and one company offers all of these multiple different services, but it's housed and controlled by the same company. Whereas horizontal integration is the same or similar services. So it's just say for hospitals, it would be emergency care, and these hospitals would, or this emergency service, say that they would go out and just purchase other emergency rooms, either the whole hospital or literally just the emergency room. Some hospitals actually have their emergency rooms are actually owned by separate companies than the actual hospital, and pharmacies too. In fact, when I worked in a hospital, the pharmacy I worked in, I was actually an employee of one company, but yet the hospital that the pharmacy sat in was owned by a totally different company. So that would be horizontal integration, where it's the company is one company that offers similar services, but to a lot of different locations. Okay, and then delivery modes. Okay, so now delivery modes. Way back in the day, patients were treated at home, and the doctor, came and saw those individuals. And now, and back then, hospitals were, people really didn't go to the hospital unless they were about to die. I mean, that's pretty much was a stigma that was placed on hospitals. People just saw them as places to die. And you sometimes even encounter some of the more senior generations, even today, that still have that feeling like they don't want to be in the hospital. because to them that's where you go to die. But now that stigma has kind of mostly gone away, and hospitals are actually the preferred choice for care. I mean, think about it. You can go get whatever, really, pretty much any. If you know you have have some sort of illness or injury, the first thought is, oh, go to the hospital. They're going to have the the anything we need, whether it be X-rays or blood work or what have you. They, their chances are they're going to have it. And well, in addition, hospitals are places for medical training as well. So in addition to offering services to the, the local population, they also offer the opportunity for experience for the new um, medical employees coming into the field. So, all right. Let's see what we got here. Okay, managed care. Okay, originally and still today to some degree, the focus on medicine was to simply treat sickness or fix an injury. But more and more, that philosophy of care has shifted to a process of monitoring and maintaining your health with certain lifestyle choices. Okay? Really, what this means is you see your primary care physician, whether you're healthy or not today, or whether you're sick or healthy, and that individual helps you maintain your health and provides assistance when a specialist is needed. So we see our primary doctor and develop a relationship with them, and they keep track of our health. They, that's like all those thousands of charts I was saying. Each one of those individuals, their health is, that doctor is making sure, and when they show up, that individual shows up for their annual exam, wellness check, then the doctor will give recommendations. Go get your blood drawn, we'll check your cholesterol, etc. And if something else needed, then that physician would be like a gatekeeper. That physician would say, okay, well, you've been having heart palpitations. Maybe you should go see a cardiologist and get that checked out. And then they would kind of facilitate you going and seeing a cardiologist, for example. Okay. Well, speaking of cardiologists and specialists, that area has really changed over time. I mean, where it used to be, the physicians and even before that, I mean, like originally way back, there was like the town barber who was your surgeon, was your dentist, the barber, and then they give you a haircut while they're at it. And now, the hundreds of years later, now we've got physicians and pharmacists and nurses. I mean, there's all kinds of, and each of those has their own specializations. I mean, physicians, there's so many different, cardiologists, as I'd mentioned, podiatrists for your feet. I mean, it goes on and on. There's also home healthcare agencies. So for folks who couldn't take care, who aren't able to take care of themselves or actually get out to get the care can still come to them. There's nursing homes with different specializations for the different conditions that folks may need to be treated for. Dentists, they have so many different specialists. I mean, you have your family dentist you go see for your teeth, and then there's the the periodontist for your gums and etc. Of course, there's all the different rehabilitation organizations too. Those can run from behavioral health to substance abuse to physical therapists. Like if you have a knee surgery and just to literally get back up on your feet, you all those would be rehab. And then chiropractors, of course, who specialize in just the disorders of nerves and muscles, mainly of the spine. So a lot of change from the town barber to all that. Okay, so in summary, the evolution of healthcare is what we looked at in this video, and we looked at it in the form of payment mechanisms, from paying with chickens and livestock and farm produce, to now we're actually using more advanced methods like private healthcare and Medicare and Medicaid. Okay, we looked at treatment methods. We looked at the various different technologies, like the introduction of anesthesia, and also the record keeping, whether paper or EHR. We looked at delivery modes. and we looked at the roles of the providers. So where will we go from here? Okay, so the next steps, next videos, we're going to summarize the U.S. legal system, the 3 sources of law and classification of laws. Then we're going to explain current laws, accreditation, licensure, and certification standards related to health information initiatives from the national, state, local, and organizational levels. Hope you found this first video interesting and have fun learning.